Prometric QA and rationals. Questions 181 to 240. 181. Which action by the nurse indicates understanding of herpes zoster? A. The nurse covers the lesions with a sterile dressing. B. The nurse wears gloves when providing care. C. The nurse administers a prescribed antibiotic. D. The nurse administers oxygen. 181. Answer B. Herpes zoster is shingles. Clients with shingles should be placed in contact precautions. Wearing gloves during care will prevent transmission of the virus. Covering the lesions with a sterile gauze is not necessary, antibiotics are not prescribed for herpes zoster, and oxygen is not necessary for shingles, therefore, answers A, C, and D are incorrect. 182. There is an order for a trough to be drawn on the client receiving vancomycin. The nurse is aware that he should contact the lab for them to collect the blood, 15 minutes after the infusion. B. 30 minutes before the fourth infusion. C. 1 hour after the infusion. D. 2 hours after the infusion. 182. Answer B. The lab should be contacted in order to allow time for the personnel to arrive and draw the trough level. The maximum amount of time prior to this dose is 30 minutes. If possible, the trough should be drawn 5 minutes prior to a third or fourth dose. The times in answers A, C, and D are incorrect times to draw blood levels. 183. The client using a diaphragm should be instructed to refrain from keeping the diaphragm in longer than 4 hours. B. Keep the diaphragm in a cool location. C. Have the diaphragm resized if she gains 5 pounds. D. Have the diaphragm resized if she has any surgery. 183. Answer B. The client using a diaphragm should keep the diaphragm in a cool location. Answers A, C, and D are incorrect. She should refrain from leaving the diaphragm in longer than 8 hours, not 4 hours. She should have the diaphragm resized when she gains or loses 10 pounds or has abdominal surgery. 184. The nurse is providing postpartum teaching for a mother planning to breastfeed her infant. Which of the client's statements indicates the need for additional teaching? A. I'm wearing a support bra. B. I'm expressing milk from my breast. C. I'm drinking 4 glasses of fluid during a 24-hour period. D. While I'm in the shower, I'll allow the water to run over my breasts. 184. Answer C. Mothers who plan to breastfeed should drink plenty of liquids, and 4 glasses is not enough in a 24-hour period. Wearing a support bra is a good practice for the mother who is breastfeeding as well as the mother who plans to bottle feed, so answer A is incorrect. Expressing milk from the breast will stimulate milk production, making answer B incorrect. Allowing the water to run over the breast will also facilitate letdown when the milk begins to be produced, thus, answer D is incorrect. 185. Damage to the 7 cranial nerve results in A. Facial pain. B. Absence of ability to smell. C. Absence of eye movement. D. Tinnitus. 185. Answer A. The facial nerve is cranial nerve 7. If damage occurs, the client will experience facial pain. The auditory nerve is responsible for hearing loss and tinnitus. Eye movement is controlled by the trochlear or C4, and the olfactory nerve controls smell. Therefore, answers B, C, and D are incorrect. 186. A client is receiving Pyridium, phenazopyridine hydrochloride, for a urinary tract infection. The client should be taught that the medication may A. Cause diarrhea. B. Change the color of her urine. C. Cause mental confusion. D. Cause changes in taste. 186. Answer B. Clients taking Pyridium should be taught that the medication will turn the urine orange or red. It is not associated with diarrhea, mental confusion, or changes in taste, therefore, answers A, C, and D are incorrect. Pyridium can also cause a yellowish color to skin and sclera if taken in large doses. 187. Which of the following tests should be performed before beginning a prescription of Accutane? A. Check the calcium level. B. Perform a pregnancy test. C. Monitor apical pulse. D. Obtain a creatinine level. 187. Answer B. Accutane is contraindicated for use by pregnant clients because it causes teratogenic effects. Calcium levels, apical pulse, and creatinine levels are not necessary, therefore, answers A, C, and D are incorrect. 188. A client with AIDS is taking Zovirax, Acyclovir. Which nursing intervention is most critical during the administration of Acyclovir? A. Limit the client's activity. B. Encourage a high carbohydrate diet. C. Use an incentive spirometer to improve respiratory function. D. Encourage fluids. 188. Answer D. Clients taking Acyclovir should be encouraged to drink plenty of fluids because renal impairment can occur. Limiting activity is not necessary, nor is eating a high carbohydrate diet. Use of an incentive spirometer is not specific to clients taking Acyclovir, therefore, answers A, B, and C are incorrect. 189. A client is admitted for a CAT scan. The nurse should question the client regarding A. Pregnancy. B. A titanium hip replacement. C. Allergies to antibiotics. D. Inability to move his feet. 189. Answer A. Clients who are pregnant should not have a CAT because radioactive isotopes are used. However, clients with a titanium hip replacement can have an MRI or CAT scan, so answer B is incorrect. No antibiotics are used with this test and the client should remain still only when instructed, so answers C and D are not specific to this test. 190. The nurse is caring for the client receiving Amphotericin B. Which of the following indicates that the client has experienced toxicity to this drug? A. Changes in vision. B. Nausea. C. Urinary frequency. D. Changes in skin color. 190. Answer D. Clients taking Amphotericin B should be monitored for liver, renal, and bone marrow function because this drug is toxic to the kidneys and liver and causes bone marrow suppression. Jaundice is a sign of liver toxicity and is not specific to the use of Amphotericin B. Changes in vision are not related, and nausea is a side effect, not a sign of toxicity, nor is urinary frequency. Thus, answers A, B, and C are incorrect. 191. The nurse should visit which of the following clients first? A. The client with diabetes, with a blood glucose of 95 mg per deciliter. B. The client with hypertension being maintained on. C. The client with chest pain and a history of angina. D. The client with Raynaud's disease. 191. Answer C. The client with chest pain should be seen first because this could indicate a myocardial infarction. The client in answer A has a blood glucose within normal limits. The client in answer B is maintained on blood pressure medication. The client in answer D is in no distress. 192. A client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication. A. Once per day in the morning. B. 3 times per day with meals. C. Once per day at bedtime. D. 4 times per day. 192. Answer B. Pancreatic enzymes should be given with meals for optimal effects. These enzymes assist the body in digesting needed nutrients. Answers A, C, and D are incorrect methods of administering pancreatic enzymes. 193. Cataracts result in opacity of the crystalline lens. Which of the following best explains the functions of the lens? A. The lens controls stimulation of the retina. B. The lens orchestrates eye movement. C. The lens focuses light rays on the retina. D. The lens magnifies small objects. 193. Answer C. The lens allows light to pass through the pupil and focus light on the retina. The lens does not stimulate the retina, assist with eye movement, or magnify small objects, so answers A, B, and D are incorrect. 194. a client who has glaucoma is to have miotic eye drops instilled in both eyes. The nurse knows that the purpose of the medication is to A. Anesthetize the cornea. B. Dilate the pupils. C. Constrict the pupils. D. Paralyze the muscles of accommodation. 194. Answer C. Miotic eye drops constrict the pupil and allow aqueous humor to drain out of the canal of Schlemm. They do not anesthetize the cornea, dilate the pupil, or paralyze the muscles of the eye, making answers A, B, and D incorrect. 195. A client with a severe corneal ulcer has an order for gentamicin GTTQ 4 hours and neomycin 1 GTTQ 4 hours. Which of the following schedules should be used when administering the drops? A. Allow 5 minutes between the two medications. B. The medications may be used together. C. The medications should be separated by a cycloplegic drug. D. The medications should not be used in the same client. 195. Answer A. When using eye drops, allow 5 minutes between the two medications. Therefore, answer B is incorrect. These medications can be used by the same client, but it is not necessary to use a cycloplegic with these medications, making answers C and D incorrect. 196. The client with color blindness will most likely have problems distinguishing which of the following colors? A. Orange. B. Violet. C. Red. D. White. 196. Answer B. Clients with color blindness will most likely have problems distinguishing violets, blues, and green. The colors in answers A, C, and D are less commonly affected. 197. The client with a pacemaker should be taught to A. Report ankle edema. B. Check his blood pressure daily. C. Refrain from using a microwave oven. D. Monitor his pulse rate. 197. Answer D. The client with a pacemaker should be taught to count and record his pulse rate. Answers A, B, and C are incorrect. Ankle edema is a sign of right-sided congestive heart failure. Although this is not normal, it is often present in clients with heart disease. If the edema is present in the hands and face, it should be reported. Checking the blood pressure daily is not necessary for these clients. The client with a pacemaker can use a microwave oven, but he should stand about 5 feet from the oven while it is operating. 198. The client with enuresis is being taught regarding bladder retraining. The nurse should advise the client to refrain from drinking after A. 1900. Born in 1200. Circa 1000. D. 0700. 198. Answer A. Clients who are being retrained for bladder control should be taught to withhold fluids after about 7 p.m. or 1900. The times in answers B, C, and D are too early in the day. 199. Which of the following diet instructions should be given to the client with recurring urinary tract infections? A. Increase intake of meats. B. Avoid citrus fruits. C. Perform pericare with hydrogen peroxide. D. Drink a glass of cranberry juice every day. 199. Answer D. Cranberry juice is more alkaline and, when metabolized by the body, is excreted with acidic urine. Bacteria does not grow freely in acidic urine. Increasing intake of meats is not associated with urinary tract infections, so answer A is incorrect. The client does not have to avoid citrus fruits and pericare should be done, but hydrogen peroxide is drying, so answers B and C are incorrect. 200. The physician has prescribed NPH insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? A. I will make sure I eat breakfast within 2 hours of taking my insulin. B. I will need to carry candy or some form of sugar with me all the time. C. I will eat a snack around 3 o'clock each afternoon. D. I can save my dessert from supper for a bedtime snack. 200. Answer C. NPH insulin peaks in 8 to 12 hours, so a snack should be offered at that time. NPH insulin onsets in 90 to 120 minutes, so answer A is incorrect. Answer B is untrue because NPH insulin is time-released and does not usually cause sudden hypoglycemia. Answer D is incorrect, but the client should eat a bedtime snack.